An avid hockey player growing up, Tony Sakinic of San Francisco was never one to complain about a little pain.
My left knee was hurt about 40 years ago, and I played hockey on it and other sports for about 25 years, after that.
And it took its toll. Favoring his knee, Tony eventually underwent a hip replacement. Now recovered, he turned his focus on his original injury. Doctors told him he needed a full knee replacement.
For something like this, you have to comparison shop. What are you supposed to do, call them up and ask them if they're any good?
Elliott Hospital answered the call.
Keep doing the new things.
Dr. Lawless, when he was having a follow-up with me, said that they have a new robotic-assisted surgery that has much better results.
This is his knee we're looking at that the computer's reconstructed.
This is Mako, a robotic arm that allows doctors to perform surgery with accuracy that hasn't been seen before.
It really balances things out perfectly, and what I love is that you know that before you do anything to him. I know it's perfect before I make any changes in the patient.
It begins by taking a CAT scan of a patient's knee and creating a 3D image,
which will really allow us to make the fine-tune adjustments, and that's where the magic is with this thing.
At 10:14 in the morning, the first incision is made into Tony's knee.
Now we have to tell the computer exactly where he is in the room.
Once the computer model is made, doctors attach implants that create a roadmap for surgeons to follow. If the surgeon goes outside of the virtual boundaries, the robotic arm shuts off. The surgeon guides the robotic arm to rid the area of arthritic bone and cartilage.
The robot won't let me do anything wrong. So if it stops like that, something's moving here and it says stop, reset, because we're going to do this perfect.
Meanwhile, outside, Tony's family eagerly awaits.
He'll feel better, and when he walks up the stairs, he sounds a bit like an ogre, so, hopefully it'll help with that.
All right, one last try to make sure we're happy before we put the very last piece in.
Just more than an hour after the first cut, Dr. Lawless puts in the final implant.
So he's got a pretty new metal surface to walk on, which matches up to this nice new plastic piece down here. I think the surgery went really smoothly. Tony had a really awful knee. He's been living with that for a while.
I feel a little bit of pain on the backside.
And less than 3 hours after surgery is complete, Tony is back on his feet and checks out of Elliott Hospital. How are you feeling?
Feeling great.
3 weeks later, there's no hesitation in Tony's steps. Where there used to be a noticeable limp is a long, fast stride.
I can actually do things like squats right now. And
you couldn't do that before, could you?
I could do it before, but it would grind. It would make noises.
But Tony's goals are far from done.
I'm going back to San Francisco. I think there's a rink there that I can go to. My skates have been in storage for a while. I'll pull them out. I'll probably go in a month.
Pursuing his passion, one step at a time.